Hello, welcome to today's presentation titled University Healthcare Systems, Implementation of an Electronic Healthcare Record. The following presentation is a proposal for EHR implementation by Health Frontiers Technologies, a Tampa, Florida-based data management organization specializing in customized and innovative healthcare information systems. The project mission is to maximize healthcare quality by implementing a state-of-the-art electronic health record for University Healthcare Systems, the premier healthcare organization in the greater Tampa Bay area. The goals supporting the mission consist of configuring a customized EHR system and training users within 12 months of the project start date, increasing patient satisfaction scores within 6 months of full implementation, and reducing physician order errors by 20% within 12 months of implementation. This project was developed using Microsoft Project 2010. Microsoft Project is an incredibly user-friendly program which organizes major project components and their subcomponents into a master plan or roadmap. This roadmap outlines all project steps to the stakeholders, allowing them to monitor the project's development status. Lastly, it is a flexible platform which allows for project changes, including those in timing and expenditures, and adjust planning roadmaps downstream of changes automatically. The implementation team will be comprised of two independent groups, the IT group, which will configure all systems, and a training group which will train users as each subcomponent comes online. Utilizing independent configuration and training teams will reduce the time required to implement the electronic health record. The configuration team can move directly onto the next task while training begins on the task just completed. Training within a department will be conducted one subcomponent at a time. However, training may occur across departments simultaneously since each department maintains its own staff. The major components of this project consist of modules for patient information management, laboratory, pharmacy, and the clinical information system. It is expected that configuration and training for each component will take approximately 8 months. According to our plan, it will take 41 days for the patient information component, 35 days for the laboratory component, 64 days for the pharmacy component, and 120 days for the clinical information system component. Each major plan component consists of various subcomponents. Each subcomponent has a configuration schedule and may or may not include a training schedule. Configuration and training tasks are assigned a start date in MS Project, and a subsequent expected end date is assigned based on the length of time each task requires to complete. Configuration and training tasks, when required, are automatically placed into a Gantt chart. This allows easy visualization of task sequences and their scheduled time to completion. Moving on to other components, the laboratory component is expected to take 35 days and consists of independent modules for chemistry, microbiology, and anatomic pathology. The pharmacy component is expected to take 64 days and consists of inpatient and outpatient pharmacy, electronic medication administration record, barcode medication administration, and adverse reaction tracking. And finally, the clinical information systems component consists of the clinical rules engine, intake and output, patient education, order management, vitals and measurements, results reporting, clinical documentation, and computerized provider order entry. It's expected to take 120 days to complete this component. As stated earlier, one of the strengths of MS Project is the software's ability to adjust schedules when changes are made to the plan's timelines. For example, configuration of the order management subcomponent is expected to last 30 days, ending on January 15, 2013. Results reporting configuration is expected to start the next day on January 16, 2013. Should order management configuration end 10 days earlier, its end date can be adjusted and all subsequent downstream task schedules will be adjusted accordingly. In conclusion, Health Frontiers Technologies intends to implement a customized electronic health record for university healthcare systems in approximately 8 months. The use of MS Project 2010 is a valuable tool in planning this project. It is user-friendly and requires only basic knowledge of Microsoft software applications. It takes user data and creates Gantt charts to visualize project tasks. Changes made to the plan during implementation are automatically updated. Lastly, and perhaps most importantly, all data is shareable among project stakeholders. This concludes the presentation. Thank you for your time and attention.